Sawadee and good afternoon. Today is Tuesday, the 11th of May, 2021. I'll start off first with the numbers that we have for today. 1,919 is a number recorded for today, with 1,829 new recoveries. We have today, to date, 29,435 active cases or cases still being treated currently in Thailand. We have recorded for today 31 new fatalities. The cumulative number of fatalities stands at 452. For the fatalities, almost half of the fatalities today are patients with high blood pressure, followed by diabetes and cholesterol. 17 cases or more than half contracted the virus from family members. So Dr. Tawisin just now gave us a briefing and ended with a lot of questions that were posed, addressed to him by the public as well as the media as well. I'll get to that towards the end of the briefing. But as for observations, we have some observations here that compared to the first and the second waves, the current wave is actually more prolonged with higher number of infections actually. And while the situation may look a bit stable, the number of new infections is not yet declining. But to look at it on the nationwide, countrywide level, we have seen an increasing number of provinces without new confirmed cases. So if you count the provinces countrywide as well, the situation seems to be towards the side of improving a little bit. But infections, of course, are still concentrated in the hotspot, which is Bangkok and the vicinity, where several new cases were detected from active case finding. And fortunately, in the past day, no new clusters were found in Bangkok, except that one minor one, which is a wet market in Nonthaburi province. So as mentioned yesterday, there's this issue about the temporary suspension of foreign nationals coming in from some countries, wherein the CCSA has confirmed reports that a Thai national, female, traveling from Pakistan to Thailand with transit in Dubai had been infected with the COVID variant, which was first detected in India. So the CCSA meeting yesterday requested the Ministry of Foreign Affairs to temporarily suspend the issuance of the certificates of entries or COEs to all foreigners traveling from countries which have widespread transmissions of the virus, of the variant, And in response to this, the Ministry of Foreign Affairs has complied with the recommendations of the CCSA and temporarily suspended the issuance of the certificates of entry to all foreign nationals traveling from Pakistan, Bangladesh, and Nepal into Thailand, starting from yesterday, effective yesterday, the 10th of May, 2021. And this also includes those transiting in other places but originating from these countries. This measure is only temporary as the Thai government is trying its best to prevent the emergence of the spread of the new variant in the country. And this is applied only to foreign nationals departing from these three countries mentioned. However, for Thai nationals, diplomats on mission in Thailand and their families and permanent residents of Thailand traveling from these countries are still able to return to Thailand at this time. One important piece of information is about the economic relief measures. The cabinet had approved the economic relief measures to assist people, and including entrepreneurs, who had been adversely affected by the current wave of COVID-19. The allocated budget amounts to 225 billion baht, and that will include the reduction of utility fees and the distribution of allowances to various target groups, covering 51 million people, and it is expected that this will help sustain the economy at the micro level. Another information is about the insurance scheme and grant for medical staff. So the government has placed importance on the medical staff and frontline personnel in combating COVID, and has worked with the Office of the Insurance Commission to develop a health insurance scheme to provide compensation for medical personnel in case of any death, coma, or infection arising from work related to COVID. This morning, the Prime Minister received the insurance package worth 275 billion baht, covering for 270,000 healthcare workers. Received this package from the Office of the Insurance Commission. And the Thai General Insurance Association and its members also donated 50 ventilators on the same occasion. And you have a short media clip there on screen for you about this. Yes, also in addition, the Prime Minister, on behalf of the government, also handed over a grant to healthcare workers of the Ministry of Public Health and supporting personnel of the Royal Thai Police who were affected by working conditions from COVID. And this amount was collected from public donation to support the government in dealing with the crisis. So as I mentioned, Dr. Tawisin just now received a couple of questions addressed to him from the public and from the local media. I'll run through around 3 of this for you. So the first is that the CCSA had received requests from the Restaurant Entrepreneur Association for, firstly, to consider lifting restrictions for dine-in in the maximum controlled areas, maximum controlled and strict area, the dark red area, after the 14-day deadline reaches on the 14th of May. The second request is about allocating vaccines for restaurant staff. Now, firstly, I'd just like to say first that the CCSA acknowledges the hardships and difficulties faced by restaurant owners as well as restaurant staff, because as you know, in the dark red zone, the restaurants have been prohibited from operating in terms of dine-in and only in terms of food delivery or takeaway service. And of course, that has affected the restaurant sector in Thailand. The restaurant staff as well, who, of course, aside from preparing food for restaurants, they have to also cater to their own needs, their families, putting food on their table as well. So we fully acknowledge this concern. So both of the requests had been forwarded to the Ministry of Public Health for consideration, and it's still being under discussion. And once the deliberation is finished, the CCSA will make the decision based on the inputs of the Ministry of Public Health. On vaccination of staff, the CCSA concurs that if restaurant staff are vaccinated as one of the priority groups, this will also help ensure the safety of the general public. Because actually, everybody has to eat. So when people order food or cook food or order food from restaurants, of course, it is the risk that they might be getting from restaurant staff. And this is to ensure the safety of the general public as well. So therefore, the CCSA fully supports this proposal that no one is safe until everyone is safe. And as soon as there is a decision on this matter, it will be made public. Another question is about why do some incoming travelers with negative results of COVID still test positive after arriving in Thailand? So there is the possibility that infection could not be detected if the test was not done in the right period. So since last year, only about 1% of people who were found to be infected with COVID after their arrival in Thailand, despite having negative results prior to coming to Thailand. So only 1% of those who were negative outside Thailand and became positive in Thailand. There was only 1% of that happening since last year. So since all Thais and foreign nationals are required to stay in state quarantine or alternative state quarantine for 14 days, there is in fact limited chance that the virus will be spreading to the general public. So the last question that I'll talk about is about the report that previously 3 personnel from the Royal Thai Embassy in New Delhi, India were infected with COVID and brought back to Thailand for medical treatment. There was a question posed that are they infected with the variant that was first found in India? What will be the screening measures? So we're still awaiting for the laboratory test to verify the strain of the virus contracted by 3 of our Thai embassy staff in New Delhi. Meanwhile, we give high importance to this. We will focus on the investigation of the case, the genome testing as well. And the Ministry of Foreign Affairs, in the meanwhile, has already suspended issuing COEs for foreign nationals traveling from India, Pakistan, Nepal, and Bangladesh, as I mentioned just now. And furthermore, all travelers are still required to be quarantined for 14 days. So in closing, I'd just like to mention that there's a soundbite which is very important: vaccine for victory. As we prepare to provide vaccination to the public in June, which will be a significant progress in reducing the risks of contracting the virus, or in terms of reducing the severe symptoms or even deaths. If you get a COVID vaccine when it is available, you will firstly prevent yourself and loved ones from getting infected. Number 2, help society reach community immunity. Number 3, help in making sure that schools, businesses, and communities can reopen safely. And lastly, 4th, putting us one step closer to ending the pandemic. And you had some infographics there on screen for the visualization. So thank you very much for your attention. Have a very pleasant rest of the week, and we'll see you again next time. สวัสดีครับ